Hey everyone, it's now time to discuss our next module. We just went over working with the novice learner. However, now let's move ahead to touch on working with the experienced learner. This type of learner has a different set of challenges. You might find that creating teaching moments might be a little bit more difficult here. Maybe this type of learner already knows quite a lot, or they're a little bit more resistant to learning, especially with some of the more basic techniques. No matter what the situation, we will discuss some evidence-based strategies for approaching this type of learner. So during the session, we plan to identify and define the experienced learner and illustrate how their goals might be different than other learners. We'll cover 3 teaching techniques for this group, including the 1-minute preceptor, effective questioning, and the SNAPS technique. And finally, we'll have time at the end to discuss on the application of some of these techniques to this type of learner. So first, let's start with who is the experienced learner. First off, this is not based on the time duration of training. We are not going to use terms to define who this is, like who's, what year in medical school or what year in residency training. Generally, these types of learners should be thought of being on the manager and educator roles of the RIME framework. As a reminder, that stands for reporter, interpreter, manager, and educator. These were terms that were first used in 1999 as a way to develop an evaluation system for students during their clerkship performance. So as a reminder for the manager and educator roles, the manager organizes information and resources to prioritize differential diagnoses and diagnostic and treatment plans using available evidence. This is where the majority of our residents are and where we would like our students to be. Educators, on the other hand, are able to articulate what is known, to determine what still needs to be known, and convey medical knowledge and its limitations to patients and their colleagues. This is the ultimate goal of where we want our residents to be by the time of graduation so that they're able to become independent practitioners. Here are the skills that we see in experienced learners. These are learners that are able to develop and defend diagnostic and therapeutic plans. And here we're not just talking about basic differentials, but really an active working list of what they're concerned about. They can apply clinical reasoning to individual patient scenarios that are independent of what's written sort of in the textbook. And finally, they're able at this point to develop fundamental knowledge needed to practice, and they really just need to refine what they know and continue to apply it in the clinical space. Let's think about what the goals of the experienced learner are so that you know how to guide them. They're really looking to find out more beyond just your personal practice pattern and want to know the evidence behind the decisions that are made by faculty. They want to be able to explain their clinical reasoning to others rather than just sort of parrot the answer. And hopefully they feel pretty comfortable at this point with bread and butter emergency medicine cases and really want to focus on rare or life-threatening cases, uncommon diagnoses, or uncommon presentations of common diseases so that they're competent to face anything after graduation. The techniques that we're going to go over in the next few slides are the 1-minute preceptor, effective questioning, and SNAPS. So first, let's start with the 1-minute preceptor. This is one of the easiest and most effective teaching tools when we review the literature. It not only gets the learner to pick and really define a diagnostic plan, but they also get the opportunity to defend it. And this is a great method if you only have 1 to 2 minutes of dedicated time and the learner is in a good place to talk about a case. It's really important to try to avoid this if you're in a situation where you're going to be interrupted over and over. And I know that's easier said than done in the emergency department setting, but really it should only take a couple minutes to get through sort of this stream of consciousness. In the 1-minute preceptor, you're going to start with the learner to present a case, and then you're going to force them to commit to a diagnosis and a plan. Then you're going to probe them about why they said this answer, basically asking what evidence support this plan and how they got there. Then you're going to decide the one thing that you want to teach. Even if the learner gives you a right answer, you should be able to find something interesting about the case to teach them. And remember that the experienced learner isn't going to have time to sit down for a whole lecture. They really just want to take one crucial learning point away. It's really important to keep your learning points broad and general and allow this discussion to be not really focused on something specific that they said so that the learner doesn't have a reason that they have to become defensive about their statement that they said. You definitely don't want the learner to feel judged or like they did something wrong. So it's really important to reinforce the positives of their reasoning. And remember that positive reinforcement is always the strongest tool to keep a learner growing. Finally, at the end, there's some time to make some comments about corrective mistakes. These should be relatively minor, and let them know about things that they can work on for the future. Now let's move to the next technique, which is effective questioning. As a reminder, this can be a great approach, but it also can be, construed as pimping. And I think all of us have had negative experiences with pimping. The goal is to really not use questioning to prove who's right or wrong, but kind of allow the learner to apply their knowledge openly. It's really important to consider that the space that you do this technique in is really important, including who's listening and sort of any outcomes that you might not realize that you could affect. If you're questioning in front of a patient, you might destroy sort of the patient-doctor relationship between the learner and the patient. And so thinking about the setting that you're doing this in is very important. There's a couple of options of ways you can do this. One is the up the ladder technique. Basically, you want to avoid making the senior learner look bad in front of their peers and really allow the group to work together. And so this is perfect if you have several levels of learner as a team. So first you would ask your most junior learner, which is typically a student, a question and sort of allow them to answer what they know. And then the next person to chime in would be the junior level resident and kind of to add to the knowledge that they can share. And then finally allow the senior resident to assist with some of sort of the higher level knowledge. This also really is a great way to facilitate your senior learner with some of the teaching that's occurring as well. The second option, or the second way to do this, is using what ifs. And here you can take a simple case that the experienced learner might really already know a lot about and make it more challenging by modifying the aspects of the case. So for example, if they give an antibiotic choice that's correct, you can kind of change the scenario by changing the demographics of the patient. So saying things like, well, what if this patient was pregnant? What if they were allergic to that antibiotic? What if they were pediatric? What would the dose be then? This is great because it really can remove limitations from a pretty straightforward case and turn it into a great teaching case. The final teaching technique that we'll cover is called SNAPS. This is similar to the 1-minute preceptor, but a little bit more thorough. It definitely takes practice to get it right, and is important that you have a conversation up front with your learner that you're going to be using this technique and really agree on utilizing it together for learning. So going through the steps, they're pretty simple. First, you want the learner to summarize the history and physical really kind of into that 1 to 2 sentence statement. Next, you want them to commit to a very narrow differential, really just like their top 2 to 3, and then have them rank them in likelihood. Probe them a little bit more about why they chose these or why they prioritize these, and try to see if there are unknowns that still exist that need to be looked into. Together, you can work on next steps. So is it that you need to look up something further, or what the plan would be for the patient? And finally, really identify some takeaway learning points or topics that will be looked up later. So something that maybe the junior learner can read more about, or the senior level learner can learn a little bit more about as well. All right, so going through our take-home points, when working with the experienced learner, you want to make sure that there is sort of time and space for them to demonstrate their knowledge. Give them the opportunity to either experience firsthand or kind of talk through atypical scenarios. Make sure that you focus on the evidence behind the decisions that you're making, not just your own personal practice. And as a reminder, with the right skills, even the most basic clinical cases can be used to teach the experienced learners. Hopefully today you walk away with 3 techniques that you can use with these types of learners, including the 1-minute preceptor, effective questioning, and SNAPS. It's now time for our post-curriculum activity. Using the activity printout accompanying this module, this will assist the questions that we're going to be talking through. So here's a case we're going to talk through. Your PGY3 presents you a case of a 35-year-old with bilateral lower extremity edema. This case might be pretty simple for this level of learner. However, using some of the skills we just discussed, there are ways to make this case, have some opportunities for learning. So using one of the techniques we just discussed, 1-minute preceptor, effective questioning, or SNAPS, please discuss a scenario or line of questioning for how you might make this case more interesting for this high-level learner.